Okay, so today with Dr. Selebi, our specialist from consultations and also from All-on-4, All-on-6, dentures, every solution you can imagine doctor has in his mind and on his x-rays. So today we start with All-on-4.
Of course.
What is All-on-4? What is for All-on-4? Please, doctor, tell us everything about it.
Of course. First of all, if a patient needs All-on-4 treatment, it means he or she needs to remove everything or already removed everything inside his or her mouth. That means there is no teeth inside the mouth, or all of the teeth unfortunately need to be removed. When we remove the teeth, if there is enough space, we would like to do 6 implants. But if there is not enough bone inside the bone jaw, we have to apply at least 4 implants, because 4 implants are enough to load top of implants as a 12 teeth. In this x-ray, the patient, I remember this patient was a very old lady. She has been using removable dentures for like 55 years. She was 75 years old and everybody told her you cannot use fixed prosthesis. But when we examined her, we could able to find enough spot in the upper jaw for 4 implants, for the lower jaw for 4 implants, and after we insert the implants, we could be able to put a fixed prosthesis top of them, then wait for 3 months, and 3 months later we can able to do fixed prosthesis permanently top of them. Basically, All-on-4 system indicates if the back of the bone is insufficient to insert 6 implants, unfortunately you have to do 4 implants. And during the implantation, there is a machine tells us during the insert of the implants that says this implant is too tight that you can able to load immediately top of it. And if the bone is perfectly fine, at least 4 of them, you can able to do fixed implants top of them. And it is suitable for either if the patient is toothless for a long time, or if you removed the remaining teeth and do the implants immediately. This is immediate implantation, but this is All-on-6. Basically, All-on-4 is doing 4 implants and top of it fixed prosthesis.
So we can summarize first, like the first point, first highlight that All-on-4 is for people who need dentures.
Exactly.
Only for them. So there are different situations as well, as I can see. Someone has a removable, portable dentures, and he wants to relieve many patients. Patients are saying that that's the nightmare. Okay,
I know.
this removable one is a nightmare. So they are coming. You put the implants, and they have a fixed prosthesis
Immediately, at the very same day.
Very
it is
good
magic.
information.
It is very good.
Yeah, it is.
And the prosthesis looks like this. When we do All-on-4 prosthesis, it's supposed to have a metal titanium underlayer inside of it. It looks like this when we finish the prosthesis. The metal is not visible. The screw tops are visible, but we close them. When we close them, it looks like this. We close top of the screw areas. But if you cut it in a half is titanium, the other part is zirconia. We cut it, by the way. It is a full zirconia. This is a model to show. It's supposed to have a titanium underneath, because if we do it all from monolithic zirconia, it might crack. Because there will be extensions to the back, and those extensions might not be supportive enough if it is full monolithic zirconia. So it is better to put a titanium underneath the zirconium. So the look is very aesthetic and the durability is incredibly fine, perfectly fine.
So it's very hard to break it, to do something
incredibly hard. And the thing is, if the patient has to lose everything, their muscles usually not very strong, unfortunately. If the patient has been using removable dentures, their masseter muscles are already not very strong, so they do not take too much pressure. But obviously, when we finish All-on-6 or All-on-4, when we load fixed prosthesis top of them, the muscles get improved. That's why it is better to put a metal underneath the zirconia.
Okay, so we can summarize that All-on-4 is a relief for people with the portable dentures, and it's a solution when you cannot have 6 implants, which are
Definitely.
better in your opinion than 4 implants. Why people are choosing all-on-6 sometimes instead of all-on-4?
Normally, patients do not choose. We offer them. If it is possible, we always do all-on-6. This is because if this is not possible. If it is possible to do 6 implants, 6 is better, because in case of a failure of 1 implant from 6, you will have 5. In case of a failure of 2 implants from 6, you still have 4 more implants to load top of them. But in case of a failure of 4 implants, you will have 3, which is not very good situation. That's why at least 6 implants is the ultimate solution. Sometimes we do 5 implants, sometimes we do 7 implants. It depends on the bone structure, but usually all-on-6 is a very catchy name, so you can able to keep it in mind. All-on-4 is a very catchy name, so you can keep in mind. But if we could able to find one more spot, we can able to do one more implant. Let's say normally this patient could have one more implant here, but no need to, because she has been toothless for long time.